Good morning, class. Today, we will be delving into the fascinating world of arthropathies. By the end of this lecture, you will be able to identify and demonstrate knowledge of abnormalities in the skeletal system with a focus on the appendicular and axial systems. We will specifically analyze 4 types of arthropathies: osteoarthritis, rheumatoid arthritis, gout, and septic arthritis. Let's start by clarifying the terms we will use throughout the lecture. First, it's essential to understand the difference between a sign and a symptom. A symptom is a subjective manifestation of a disease, something that the patient perceives, like headaches or fatigue. On the other hand, a sign is an objective manifestation of a disease, which can be observed or measured by a practitioner, such as elevated blood pressure or increased temperature. Next, let's define etiology. Etiology refers to the causes or origins of a disease. Understanding the etiology of an arthropathy allows us to comprehend its progression and how to address it. Correspondingly, we have pathophysiology, which is a study of the functional changes associated with the disease. This aspect will help us understand how these arthropathies affect the body at a cellular level and the subsequent impact on the individual. Now, let us categorize our focus into 4 distinct types of arthropathies. Osteoarthritis, a degenerative joint disease traditionally viewed as a wear and tear condition but is now understood to have genetic, physical, and biochemical influences. Rheumatoid arthritis, an autoimmune disorder characterized by symmetrical joint inflammation and systemic symptoms. Gout, a crystalline arthropathy associated with monosodium urate crystal deposition. Septic arthritis, joint infection resulting in inflammation and joint effusion. Osteoarthritis. Let's dive deeper into osteoarthritis OA. The signs and symptoms often include stiffness after periods of rest, though this usually subsides within 30 minutes. Patients may experience unilateral joint pain, mainly affecting the hands, knees, and hips. In advanced cases, the presence of bone spurs or osteophytes becomes evident. The etiology of OA is multifaceted. While wear and tear was once considered the primary cause, we now recognize genetic factors may predispose certain individuals, along with environmental influences and lifestyle choices that impact joint health. In terms of pathophysiology, we once believed that OA did not have an inflammatory component. However, recent findings show that the presence of cytokines increases in the synovial fluid of OA joints. Cytokines affect cartilage integrity and have a role in cartilage degradation. Other changes include subchondral bone remodeling, leading to osteophyte formation. Imaging plays a critical role in diagnosing OA. X-rays typically show joint space narrowing, subchondral sclerosis, and osteophyte formation. MRI can also be utilized but tends to be reserved for cases where X-rays yield ambiguous results. Rheumatoid arthritis. Moving on to rheumatoid arthritis RA, we see the signs and symptoms contrast with OA. RA is symmetric, affecting joints on both sides of the body, commonly in the hands and feet. Patients often experience morning stiffness that persists for more than 30 minutes, along with systemic symptoms such as fatigue. The etiology of RA lies in its autoimmune nature, where the body's immune system mistakenly attacks its own tissues. Genetic predisposition combined with environmental factors contribute significantly to the development of RA, making it critical to assess family history alongside lifestyle factors. Pathophysiologically, RA is characterized by synovial lining thickening and formation of pannus, which invades cartilage and leads to erosions at bone interfaces. The increased presence of immune cells and resultant cytokine release further exacerbates joint destruction. Imaging for RA reveals joint effusions and erosions, with X-rays showcasing loss of joint space and the presence of osteopenia around the joints. MRI can detect early changes and is particularly helpful in staging the disease. Gout. Gout presents uniquely with sudden, intense pain, often described as feeling like the affected joint is on fire. Commonly, the big toe is affected, marked by swelling and tenderness. The etiology centers around the deposition of monosodium urate crystals in the joints due to hyperuricemia. Factors such as dietary habits, obesity, and genetic predisposition can influence serum uric acid levels, leading to gout attacks. Pathophysiological responses involve a robust inflammatory reaction, where immune cells invade joint tissues, attempting to engulf the crystals. This inflammatory cascade leads to joint swelling and chronic damage if recurrent flares occur. Imaging in gout can show classic X-ray findings, including erosions with sclerotic margins and the presence of tophi in advanced stages. Ultrasound can also aid in early diagnosis by detecting crystal deposits. Finally, let's look at septic arthritis, which represents an acute infection that can lead to a rapid deterioration in joint condition. Symptoms include sudden pain, swelling, redness, and fever. The etiology of septic arthritis primarily involves bacterial infections, with Staphylococcus aureus being the most common pathogen. Individuals at higher risk include the elderly and those with pre-existing arthritis. The infection can reach the joint via various routes, including penetrating trauma or hematogenous spread from distant infections. Pathophysiological changes include joint effusion caused by inflammatory processes and potential destruction of cartilage and bone, necessitating immediate medical intervention to prevent lasting damage. Imaging in septic arthritis may initially appear normal, but as the disease progresses, joint effusion, space narrowing, and potential bone erosion can be observed through X-ray or MRI. Summary: today we covered 4 primary types of arthropathies. Each type, osteoarthritis, rheumatoid arthritis, gout, and septic arthritis, demonstrates unique signs, symptoms, etiologies, and pathophysiological mechanisms. Imaging plays a vital role in diagnosis and ongoing assessment. Thank you for your attention. I hope you now have a clearer understanding of arthropathies. Let's proceed to some questions or case studies related to today's lecture.